Welcome to Akhand Vidyashram, the first institute of impeccable wisdom, the walking, talking encyclopedia. Kapalabhati, the cleansing of nasal sinuses. My mission, the impeccable wisdom, knowing which everything perfect is well known. My greatest discovery, Divyank, the divine design of nature with which the perfect objects are designed and created. Divyank is a reward of 60 years of integrated education. Impeccable wisdom is enlightening, and integrated knowledge is empowering. Kapha Dosha. According to Ayurveda, there are three different kinds of foodstuffs which need to be taken. As a result, you can find three different kinds of doshas. Doshas are difficulties. People who are taking Satvik food, pure vegetarian, without any problem, can lead to Kapha Dosha. In Kapha Dosha, there is an increased production of phlegm in the nasal sinuses or sinuses by and large. This is one of the price is paid by the community which lives only on vegetarian diet, does not do anything with non-vegetarian and things like that. They tend to suffer from kapha dosha. And if they are focused on the higher centers of consciousness because of intelligence or otherwise, they'll have this problem more than a common man. Kapha dosha is a problem in vegetarian, sattvic food who are intelligent, using the mind for higher and higher levels of consciousness. This is one point which I want to everybody to understand. The nasal congestion, whether it's maxillary, ethmoidal, or otherwise, is very common only with the people who are intelligent, mentally very powerful, want to do something completely, and their focus is only on the higher five centers of consciousness in the brain. I do not see these other people by and large, so let me not go into detail. And this particular video is primarily my own experience from my childhood till today, but I have suffered from it. But how I got over it, let's discuss that. Let me start. I have had nasal congestion since childhood. I could not find any ideal medical treatment from any of the known doctors in Katra, Jammu, or for that matter, in Madras Medical College during my graduation. As a result, whether I like it or don't like it, I had to accept that nasal congestion is common in me. I have to learn to deal with it. One thing. But at this particular juncture, also let me try to explain that this problem was much more just before exams or during exams, more than the place times when I had no work, intellectual work, studies, academic research, or otherwise to be done. So somewhere when brain is working, this problem is much more. What is the cause for that? I'll explain in due particular in this particular video itself. But after finishing my graduation, after training in general surgery for 1 year, to be trained for general surgery, I applied for post-graduation otorhinolaryngology ENT surgery. And the reason is very simple because I wanted to know what this particular problem is, how to get rid of this problem and be safe from it for the rest of my life. The choice was very conscious to take care of my own freedom. During the 3 years of my studies, between 1977 to 79, every ENT surgeon known to me in Chennai tried their level best to find what is the diagnosis, what is the treatment, what is the management, and how to go about it. And let me quote in quote say my focus was only allopathic medical treatment. But no one could actually tell me what was wrong, what could the cause, and why it was happening in me when there's absolutely no infection, no congestion, nothing at all. But the amount of phlegm which will flow through the nose was phenomenal. After 3 years where I couldn't get rid of my cold, and this was still singing, I thought, what am I going to do to heal other when I can't treat myself? So after 3 years, I opted out of general surgery, opted out of ENT surgery, then went to plastic surgery to sharpen my hands to do quick and very artistic and spiritual science work. After that, I have opted out general medicine, other things which I have already explained in my videos. But junction at this particular thing is I'm talking about Kapha Dosha is related to Satvik food. That was being my food from the day during my graduation, and as a result, I suffered from it. It was a big problem. This is. But let me tell you what happened thereafter. Later, first thing which I learned when I doing pranayam, Ayurveda, Yoga, Kriya Yoga, and Patanjali Yoga Sutra. When I discussed all those subjects after my initiation to simplified Kundalini Yoga, tried out different experiments, and one thing which stood out was Kapalabhati. Kapala means head, Bhati is cleansing the head. That means primarily cleansing the sinuses in my case because I had a Kapha Dosha problem all my life. The problem was still significant when I got my initiation into simplified Kundalini Yoga. Then I started learning different yogas, different schools of thoughts and other things. And one thing which seemed to help me a little bit was yoga pranayam. And there are different kinds of pranayam which I have already spoken. And one of them was Kapalabhati, this cleansing of the sinuses of the head, are cleaning the brain by and large, are making optimum use of the centers of consciousness within the brain, optimizing it, understanding their connection with autonomic nervous system, endocrine system, and by and large, and move on. Kapalabhati to some extent helped me, but did not give me complete relief. Now let me explain the few steps of Kapalabhati which are required for everyone before they opt for Kapalabhati as a treatment for cleansing of the nose or anything to do with nasal sinuses. First thing, whether it was Bhastrika, Kapalabhati, or all the things, I want everybody to be tested for different sicknesses of physical, emotional, mental, otherwise at a regular interval so that life is completely free from all the physical, emotional, mental, or other diseases completely. Perfect health does not mean absence of disease. It's complete that you should have no physical health, no emotional problem, no mental problem, no religious problem, no fight, no argument at all. Keeping those things in this particular case, it was required. So, getting completely tested for all the ailment is my recommendation for everything which to be done. That's one part. Second, like Bhastrika and Kapalabhati, sit in Vajrasana after long exercise to warm up your physical body, and that's what tapasya is. Tapas means heat. Physical exercises to produce heat, circulation is better, and then structure is concentration is on Sushmana Nadi, Nada, not Ida or Pingla Nadis. Once that is well taken care of, you are likely to benefit more. So having done the exercises, warming it up, sitting Vajrasana, sitting postures with the legs folded and sitting in that position is something which I want everybody to listen to carefully and do systematically step by step. So sit in Vajrasana. Then in this particular exercise of Kapalabhati, take a deep breath and fill the lungs completely. You are literally going to see you are taking so much of breath, your abdomen has come out, diaphragm has gone down, and the entire chest is expanded. Expand it as much as you can do. Having done that, then suddenly exhale, lungs completely empty. So your abdomen should go in, diaphragm should come up, chest should contract, and the entire thing. In this process of deep breath and forceful exhalation, expiration, would make the heat in sinuses so high that they'll dissolve and bit by bit it will recover. Jalnethi could also be tried, inhalation could also be tried, other things which can help you to liquefy and then over. So in the process of doing Kapalabhati over a period, bit by bit my sinuses opened, then all the phlegm started coming out, and over a period I found things coming down completely. There was a tremendous amount of relief from in Satvik food, Kapha Dosha from cleansing part. But I would not say that I had completely healed by that time. It was better, under control. But it was still would come up once in a while when the concentration for serious spiritual work on the head at a later date. Anyway, breathing out through the nostrils and emptying the entire vessel fully and effectively, on the whole, prepared me to lead a much better life as I started playing with Patanjali Yoga Sutra Pranayam and then Akhand Yoga's 10 stages, and things improved quite a lot. Now, having understood, I have suffered from Kapha Dosha because of my Sattvic pure diet ever since my childhood, and no treatment could be received. Then did my post-graduation for 3 years to understand the concept very clearly, but no relief. But later, Kapalabhati gave me the understanding it is a phlegm which formed, but at that particular juncture I did not realize was this Kapha Dosha of Sattvic food an asset or a liability. That is also something which was very clear. But today, after going through the whole thing, I can only say it was an asset, not a liability. I was not suffering from congestion. I was not suffering from infection. This is a different physiological process to save me from any infection which can come from outside. Now, having understood that, so I have no problem with it, but I don't have that problem because I learned with Ayurveda taking some of the astringents of Rajasic quality to counter Kapha Dosha helped me to counter it completely. Now I don't have that problem. I don't have sinuses and I don't suffer from anything. And there is no sneezing, nothing at all, because overall I have improved in the health so much that none of these things better. But over a period also, with the help of Kundalini Yoga, understanding that it is not Agnya Chakra and Sahasrara Chakra alone which Patanjali talks about 6-7 chakras. There are many more. Now I talk of 10 plus chakras. But in that, the concentration is only in the brain inside chakras, like your brainstem, midbrain, pons, medulla oblongata, anterior pituitary, posterior pituitary, and then hypothalamus, insular cortex, pineal gland, and other concepts of autonomic nervous system, as well as endocrine system, completely understanding the whole thing and learning how to deal with all those things with Ayurveda, pranayam, meditation on one side, and lifestyle other thing. Today I have no problem whatsoever. So having explained that this particular Kapha Dosha, the nasal sinuses, can be rectified with the help of Kapalabhati, Vastrika, other pranayams, at the same time Ayurveda, and also concentrate on higher concentration as and required, and you can do wonderfully well. Now, having explained the reason and what I have done, why I did the post-graduation ENT, and what happened thereafter, what I learned in this Kapalabhati and Vastrika and other pranayams, and then Ayurveda, and how I got rid of it, I have already explained. Now, let's understand proper theoretical knowledge. How does it actually work? Divine design of breathing, as I've already told you, inhalations is an active process. When air from atmosphere enters inside, atmospheric pressure, partial pressure of oxygen at sea level in Chennai is 160 mm of mercury. When it comes to alveolar level, it is 100. When it comes to the venous level, at capillary level is also 38.2%. It's again Divyank ratio. The whole thing centers like that. From that angle, this particular picture is very clear to understand how Divyank is designed and how it has designed the respiratory system, inspiration, expiration, and how it goes. I've explained again. From that point, this center plays very important, and inspiration neural response in the brain is also designed with Divyank. I have already explained. Then you have left lung has got 2 lobes, right lung 3 lobes is also in Divyank ratio. There are so many hidden factors in the process which I have explained, which should be understood by everybody to understand that perfect design of nature centers around Devyank, Devyank, and Devyank only. Now, understanding endocrine system will not go into detail, but understanding autonomic nervous system is very, very important because you need a balance of sympathetic and parasympathetic by and large. Let's talk primarily of cranial parasympathetic system, which plays very important roles in Sattvic people who are intelligent, want to do academical excellence work, good excellence research, and good contemplative work, and want to help humanity by and large. In their case, concentrating on four pairs of cranial parasympathetic nervous systems, which are parasympathetic in nature, is important. First nerve is, of course, oculomotor, which takes care of near vision with the pupil constriction with parasympathetic system to save the eyes from damage. But as far as sinus is concerned, Kapha Dosha is concerned, it is a seventh cranial nerve which supplies all the mucous membrane of all the sinuses, including mouth and other thing which is important. When your concentration is in the midbrain and pons and medulla oblongata, so-called brain stem, then these four cranial nerves become more predominant and they will start functioning to produce more heat as well as congestion to that area, which will lead to the formation of more mucus purulent material, and that's what's happening. So whenever a concentration on the brain side, as a sattvic food, Kapha Dosha is more because concentration is the higher centers, and in the process whatever little bit from the ear had come would be dissolved with the help of mucus to throw it off in the form of the cough and cold. But when I was not consciously trying to throw it out as and when it was required, it was allowed to congest for a long time, and that became the problem of Kapha Dosha. Now that I know, they immediately done and finish with it. That's one part. And it is primarily seventh cranial nerve which is responsible. And of course, ninth glossopharyngeal and vagus also play an important role in Kapha Dosha of the chest and other parts throughout the body. So parasympathetic cranial nerve, 7th, 9th and 10th play an important role. They produce it. And the treatment for this kind of patient is the sympathomimatory drugs, which sympathetic system. And I didn't want this particular thing to be taken care of, which is designed with Devyank again. So somehow with the help of pranayam, Kapalabhati, Bastrika and other things, and Ayurveda and with the diet moderation, I've been able to control the blood flow to the brain when my concentration is in the brain center. I have to excel in every academic self. I got to break old records, create new records with the presumption that they would remain for rest of the life. If they can be done, I would say it has been worth all the trial to concentration, better and better impeccable wisdom, find fault with all the things and give the impeccable wisdom which has not been done in the history of mankind till today. People might find it a little funny, but the fact is we are perfect human beings. Once we start thinking of perfection and start working with the perfection, we will get all the answers because nature is there to teach us. And that is exactly the message which I'm trying to give it to the people. Our intention is to help everyone acquire perfect data, information, knowledge, wisdom, which you don't have to forget for the rest of your life. You are the best and you can do wonders at every level for the entire humanity. From that angle, this particular video is very applicable because it produces no Kapha Dosha, no problem, but you still be very intelligent intuitively otherwise. And that's where if you are able to use senses knowledge, mental knowledge, intellectual knowledge, intuitive knowledge and impeccable wisdom within yourself from your own experiences, you are on top of the world, helping yourself and in the process help everybody else is in the process. The whole objective of Khand Vidyashram video is to enlighten everything, the kind of knowledge which is not available. This kind of knowledge is not available in the internet and any of the books otherwise. My experience, my suffering, my answers, and I have no problem whatsoever. From that angle, let's go to the next slide. This particular picture, as I told you, is a one which I play very important. This has finally helped me to how to use endocrine system, autonomic nervous system, 10 centers of thing, and call a 10 plus endocrine chakras, autonomic chakras, brain chakras, and centers of consciousness of design, whether in the physical body or outside, and show with that kind of knowledge, only you can be a totally wise person. As a result, you can have complete data, perfect without any problem, information perfect without any problem, knowledge perfect without any problem, wisdom perfectly without any problem. And I want everybody to realize from data to information, knowledge to the wisdom, at every level it should be one. There should not be need to redesign everything. Start teaching students from school, college to the university to research, perfection to the core. And that is reason which is knowledge is not available. I'm creating knowledge for everyone to understand this is what is required. So from that angle, I think I have explained Kapha Dosha, Satvik food, and what is the reason. It is not a disease, it is an asset. It is because congestion to take care of psychosomatic disorders. And my pranayam functions are even at 70 plus as good as when I was in my 20s. If I can do it, I'm sure everybody else can do it. From that angle, let me say it has been wonderful explaining using this knowledge for my own health and explaining same thing for the benefit of everybody, one and large. So thank you very much. It was lovely sharing all the knowledge over the period. Thank you.